Unong ilam kaliang persya aking dorbar tawan gejala, Dr. Mukul Sangma hak arterik ubna jeliu lalit penhiar Jurip jaga Preparedness banekun ya Jingpynkhreh COVID-19 hak distrik West Jaintia Hills kam tam akanong ba jowai kabedai ke headquarter jong ke distrik. La senderan lang yu Dr. Mukul Sangma da ki MLA berkentup yu ba Himalaya Muktan Shangpliang Zenit Sangma uba Shitlang Palia nang ta DHSMI Dr. Amanwar rengkat bat Deputy Commissioner ke distrik West Jaintia Hills uba Garod LSN Dykes ki officer bat kibe-kibe. Dr. Mukul Sangma lalit jengok Shwanengkong ya ke Saint Aloysius Hospital ke badan Umulong ha ke distrik West Jaintia Hills ke bala penyat daki Sister Hospitalers Sisters of Mercy bat kami ya ke jing penbiang nadong syadong ha ke bedai bat ke jing sumar ke bayo ya ke jing pang COVID-19 ha ke ni kejaka. Hadian kini Dr. Mukul Sangma lalit jengok saya ke Community Isolation Center jeng kidor Barshnong berkentup halat tak labok bat ha Chiliang Raj. Ha jawai, bat akan ni kejing let Jurip lai i kejing Jingpynkhreh jeng ini ki Shnong naga benta ban pensyong ya gitu gibri kebayo kejing pang COVID-19 ki bambiang ki jaka ki ngisam jongki. Layo jeng tip managi bor jong kalat tak labo Community Isolation Center ki Jingpynkhreh adu menta komba arpo Jaintia anrai 4 don ki buan bansa. Kat baha Chiliang Raj ki ladon saungut ki belayo ki kejing pang ki belawan syong penkerpang hang ni. Hadian kan ni kini kekenhuan ke Leit Sasha ke Maternity and Child Hospital ke badan Hapana Liar Jowai ke Bedairu ke Corona Care Center. Bat kumjuk Jurip ya oksigen plan ke badang yach kemat ke jingtai menta. Dr. Mukul Sangma baikren bagi bor penyat jong kini ke Corona Care Center uli jingtip bagi lele kat bala barang sumar ki buan pak sumar bat ki buan tiak hagan ke jaka. Kletu ba haduk menta kaneka Corona Care Center kadang long bebiang men pediang kinong pang bat baro kinong trish tom ber arp sau kenta ban ai kejing sumar ya kitu ke bedang yo ya kene kejing pang bat ki bawan ban syong pen kerpang ini kejaka bat ban pak sumar ha kini kejaka.
Now, particularly this Jaintia Hills region, most of the patients were compelled to be shifted to Shillong, and this is precisely because of the inadequate facilities in Jowai itself, which in turn add extra burden on the availability of beds for the COVID patients in Shillong. Therefore, the government has to provide the necessary support to the health department, the necessary support in time, not just the support, but in time. And even as we talk today, since we really don't know how the virus is going to behave, we have to keep in mind that after the second wave, we need to be prepared for the third wave. All the line departments who need to come together and fight this war against the virus must be provided all the necessary supports. We must have enough exhaustive auditing done in respect of our capabilities to fight against the virus, because when we are at war, we need to know how prepared we are. Look at the alarming number of death count on a daily basis, and look at the percentage of the death. If you're looking at the death count, it's more than 2%. Anything beyond 1% is a matter of concern. And if you look at the cause of this high death count, then we are able to also know many things which revolves around the deficiencies. And these deficiencies must be taken care of to avoid loss of precious lives. Dealing with these serious COVID patients, as per the progression of the disease, when the patients require to be shifted to ICU, if the patient required to be shifted from one district to another, the precious time which is wasted in the shifting of the patient and the challenges of getting back after getting referred or after being shifted, that is where precious time is wasted. And subsequently, besides the burden or the pressure on the hospitals in the state capital, you land up very agonizing experience for our people who have looked at vaccinating themselves. You see, there are two things. One was to convince people to agree to get vaccinated. And another thing is to ensure that who want to get vaccinated have the vaccines. You have already seen after the announcement of the government that different slots were allotted for the group of the targeted population between 18 and 44 to get themselves vaccinated. Now, this particular exercise, notwithstanding what has happened, is that people suddenly realize that, okay, though they want to get vaccinated, vaccines are not available. So therefore, it all shows that, okay, the preparedness, both the union government and the state government, the collective delay in responding to be able to be prepared to deal with these challenges of pandemic was missing.